Good morning, all. Welcome back to the second day of the Urban Forestry Days. Yesterday, according to the Zoom statistics, we had up to 600 individual people attending. That's a huge success, and up to 350 people attending simultaneously. So, and also looking where we have been broadcasted or where people have been looking to our Urban Forestry Days. This was not only a European undertaking, but we have really have had a really global outreach. Welcome to this session today, where we're focusing on urban forest and health, and we have very interesting speakers from all kind of backgrounds, from very young people starting their research to or practice up to very extinguished speakers who are experts in the field for multiple years already. So today we have for you in this first session, we have three distinguished speakers. Matilda van den Bosch, IS Global Barcelona, Matthias Braubach from the WHO in the Bonn office, and we start with Peige from China, from the Beihua University, excuse my pronunciation. She is for the vice president of the Beihua University. And she's mainly interested in links between pharmacy and forest medicine. So she will give us an introduction in forest medicine and the use of urban forests and forests in China when it comes to health aspects. So I was told, I was requested to load your presentation here. So that's what I'm doing at the moment. And I was share my screen. Paige, please, the floor is yours. You can mute your microphone and start your presentation. Thank you.
It is my great pleasure to attend the webinar today. My topic is forest-based care. Distinguished guests, experts, good morning. I am from Beihua University based in Jilin province. My name is Peige. My university is the one and only forest-intensive university in Jilin province. On behalf of my university, it is my great honor to talk about the effect of forest environment on human health. Next slide, please. I have 4 different topics I want to talk about. So forest-based care essentially look at how can we achieve the treatment, rehabilitation, and healthcare effects on human body. Currently, we have many experts from Japan, Germany, and South Korea who are looking at how can we treat chronic diseases from forest-based care. In particular, in Germany, there are many experts who have carried out this research. The health index of citizens in Germany has increased. At the same time, medical expenditure dropped by 10%. China is a latecomer in this area. In Changbaishan Mountain, we have the world-famous Korean pyronosis broadleaf trees. In Changbai Mountain, we have the most diversified biodiversity at an altitude. It was rated at one of the top 10 most beautiful forests in China in the year of 2005. Well, first of all, we select Heping town as the base of forest-based care. These are the basic informations of the survey plots in terms of forest type, longitude, altitude, and altitude. This is different types of vegetation in those areas. So we have plants, we have coniferous, we have deciduous, etc. According to our survey and research, every year from July to August, it was the prime time to carry out forest-based care. As you can see from the slide, in different function areas, we can see the tree diameter structures, and they have the J distribution. we can see a very good level of renewal in those different function areas. Next slide, please, Rick. So this is in the recreational areas. You can see the composition and also characteristics of biomass. Next slide. This is in the forest areas in terms of its features of biomass and accumulation. Next slide. This is in the rest areas, features of total biomass and also accumulation. Next slide, please. This is the moisture level, PM 2.5, and also the air avion levels. As you can see from the slide that the air quality rated A, so it's very comfortable to be here. Next slide, please. We have also carried out studies regarding forest essence. As you know that forest essence has certain positive effect on human body. Next slide. Next slide, please. In August, 39 species of forest volatiles were isolated and researched. 9 ketones, 7 alcohols, 6 esters, and olefins, alkanes, and aromatics. 28 species in leisure activity areas. So that's the area we have the most of those volatiles. Next slide, please. So in this slide, as you can see that the variations of different main forest volatiles, the alcohols, ketones, and aldehydes are at different levels. In evenings, the levels varies as well. For example, the relative content of alcohols was the highest in the morning, then decreased slowly, lowest in the evening. So this is in the leisure areas in terms of different altitudes. If you look at the yoga areas, it's quite different as well. Ketones in the yoga areas showed a unimodal change with the height. They reaches the highest content at the 120 centimeters altitude. In other words, when we carry out the forest-based care programs, we look into the altitudes and to see what kind of positive impacts they have on human bodies. So this is in the leisure areas, the ketones, aldehyde, and alcohols in terms of different content and the levels. As I said before, ketones in the forest yoga area showed a unimodal change. The changes in terms of aldehyde was not very obvious, and alcohols decreased gradually with the altitude, with the height. Next slide, please. So we have chosen 12 healthy subjects, male and female, and carried out a 3-day of a study trip. They don't have any cardiovascular diseases or neurosis. And 3 months prior to the study trip, they were not in the mountain. In the 3 days of the study, the subject took the same diet. Next slide, please. So this is the whole healthcare process in terms of what we did at certain point of the day. The whole process took 3 days and 2 evenings. Next slide, please. We used a quantifiable method to look at the before and after impact on human body. And it showed that forest healthcare program is very conducive to improve anxiety and sleep quality. Next slide, please. So this is the effect on female subjects. It certainly works for female subjects as well. Next slide. So before and after the study trip, when we look at the NK cells and also the blood lymphocytes, as you can see that we saw a certain increased level of both cells. Next slide. As a follow-up approach, we identified and showcased that forest-based healthcare program promotes plasma perforin. Next slide. Meanwhile, it also helps to promote granzyme release. Next slide. It also helps to promote plasma GRB level release. Next slide, please. At the same time, promotes the release of plasma GNLY level release.
So,
for serum cytokines, the 12, 18, and 15, the impact on those were not very obvious. According to our research, it also helps to improve the effect on plasma catecholamine. So in other words, reduce your stress. Next slide, please. At the same time, we've also selected 18 adults with diabetes, 6 males, 12 females, with average age around 65 years old. We carried out also a 3-day, 2-evening study trip. So for the type 2 diabetes, we went through a medical screening procedure. Let's have a look at our results. Next slide, please. So during the process of forest-based care program, those are some of the photos showcasing we set off the yoga we did in the forest area, etc. Next slide, please. So after 3 days and 2 evenings, we can see that a remarkable improvement on the blood glucose level of diabetic patients. Next slide. At the same time, it reduced the stress hormones of diabetic type 2 patients. But the effects on serum catecholamine, DHEA, and cortisol were not very obvious. Next slide. Having said so, after the forest-based care program, there was no significant impact on serum LL10 and 12 in diabetic patients. Next slide. Type 2 diabetic patients, after went through the program, Forest Health Care could increase the level of serum IL-15, while the level of IL-6 and TNF was decreased. Next slide. So this is about the serum perforin level in diabetic type 2 patients. As you can see that Forest program increased the level of serum perforin. So what I have shared so far from the research carried out in Heping Town, in Changbaishan Mountain. We both had healthy subjects and also people suffering from diabetic diseases. So based on our research, it showcased that in the Changbaishan Mountain area, Pinus coreensis broad-leaved forest can improve quality of sleep. At the same time, your immune system, it decreases the stress hormones in your serum, so to reduce your pressure. At the same time, it helps to regulate the fasting glucose in type 2 diabetic patients. So this is from empirical evidence. And looking ahead, we will also look into the forest-based care programs in Jilin province to really amplify its effect, to scale up its effect, and to provide more scientific evidence to this. Next slide, please. So let's have a look at our team. Very briefly, I will say a word about the team composition. So our team is the only cross-disciplinary forest team in Jilin province. We were among the first to champion this concept of forest-based care program. Beihua University is the only comprehensive university with forestry and medicine in China. So after 2 decades of cross-disciplinary research, we combined different universities in 1999, and that gave birth to Beihua University, to the only one comprehensive university of forestry and medicine in China. So we will carry on our work, we will step up our game to really enhance the impact of forest-based care program in China as well as in the world, so as to allow more people to really benefit from the forest, to really experience the beneficial impact of forest-based care program. I really love to listen to your views and ideas and your recommendations from all the experts of today. It is our sincere hope that through this platform of webinar, it could give our team a great opportunity to talk to international delegates, international experts, to promote the development of forest-based care program. That's all from me. Thank you so much. You can stop showing the slides now. Thank you.
Welcome to Beihua University.
Okay, thank you for the nice presentation. Next speaker is, I assume it's Matthias Braubach. Matthias is in fact a neighbor of our office in Bonn in normal times. We are literally at the same square, EFI and the United Nations campus. But unfortunately, we never met Matthias. So let's make this happen once we come to the office. So Matthias is working at the WHO office in Berlin. And he where he's working on health aspects related to urban green spaces. And I think some interesting and hot off the press news will be presented by Matthias. Matthias, the floor is yours.
Thank you very much. First, for the introduction and for the invitation of World Health Organization to present our work. You should be able to see my screen now. Is that correct? So I'm going to introduce some of the work at the World Health Organization. As introduced, I'm working on environment and health in a specific center of the WHO European region. And one of the issues we're also looking into is the impact of urban nature. So it's not exclusively looking at urban forests, it's any type of green we're looking at. And we're also increasingly looking into blue spaces as part of urban nature and environmental surroundings and their impacts on health. So I would like to present a little bit, starting with a quick overview on nature and health, and then looking more specifically into the impacts of urban green spaces, touching upon urban blue spaces, and also in line with what was introduced in the opening by Rick, a short trip into the current situation of COVID-19 and the lockdowns and during the pandemic, and what is the new perspective and the lessons learned in relation to nature access and health impacts. I would like to start with an overview of the relevance of nature and biodiversity, because over decades, as population grows, we do see a lot of other things going up, be it water consumption, be it energy use. And of course, that leads to problems we have with nature resources, talking about water shortage, about ocean acidification, about tropical forests. There's many things that we have to confess that we're not doing a good job in terms of keeping biodiversity and nature protected and alive. And you see that all these lines are going up in terms of how we use nature and how we exploit it and how we use the resources. And then there's the one line going down, and that is about biodiversity. And I think it is the one thing that is striking is that it goes down very much, although we are so much depending on it. And the second thing is that compared to the other data, which went back for hundreds of years, most times, we only have a very, very short knowledge on how we are actually dealing on biodiversity and nature protection. We only measure this for a few decades. So for me, the conclusion here is looking at these lines and developments, any type of nature is added value in any type of setting. And of course, specifically so in urban settings where we don't have much of nature. Some years ago, World Health Organization has partnered with the Convention on Biological Diversity at the UNEP and Environmental Program, and they produced a huge overview, the state of knowledge on biodiversity and health, that really is an encyclopedia of the biodiversity and health connections, and it covers a wide range of how nature and biodiversity have an impact on health, both in a positive and in a negative way. So everybody who wants to know more about that, this is a great source book to look at. Looking more closely into green spaces, and this is the one slide that I used to go into the pathways and the mechanism, and otherwise I will leave all of the discussion on the detailed mechanisms, how urban nature affects health, to the following speaker, Matilda, who will go in more detail into that. But just to set the scene, there's various pathways how urban green spaces, urban nature can affect health, be it by environmental benefits, be it through direct nature benefits for humans of being out in nature and enjoying nature directly. It's about social benefits, and it's what we mentioned already with the poll in the beginning. It's also a lot about mental benefits, about psychosocial well-being, about feeling good, being in contact with nature. So there's many benefits that we can derive. And in our office in Bonn, our setup is looking into three different programmatic areas: living and working environments, water and climate, and more generic environment and health impact assessment, looking at environmental issues in a cross-cutting way. And basically the work on the urban nature is in the topical area of urban and built environments. But of course, it does link to many other areas because it is overlapping and has influence and will be affected by nature, be it quality and noise, be it climate change and water access, be it impact assessment or environmental health inequalities, because also the benefits from and the access to nature is not equally distributed in our societies. Some years ago, we have done some work on urban green spaces, looking into a review of evidence on how they affect health, and then also looking into urban green space interventions to see what interventions and what measures on the local level, on physical infrastructure, on parks, on designing the urban environment, what of these interventions really work, what impact do they have? And from these two reports published a few years ago, we have produced a practical guidance document, an action brief on urban green spaces that has been translated into various languages, can be picked up on our website. And this urban green space action brief acts as a tool, as a guidance document, mostly for urban and local practitioners on how they can maximize the benefits from urban nature and putting nature into urban settings, giving access to nature to their local residents, and using the many benefits that nature gives for urban well-being. At the same time, what we really want to stress is that very often we have the impression that nature is by default good for you. And there is also a lot of pathways, there's a lot of evidence that not by default everything in nature is good for you. There are also risks and health threats. And one of the important parts in our action brief is to be very clear that there are these potential conflicts and risks. And there's one section that especially looks into how to prevent these challenges and conflicts. Because at the one side, we want to enhance and maximize the benefits of being out in nature. But at the same time, we need to acknowledge that there's also a risk section that we need to minimize and prevent from. And only if we work on both sides, maximize the benefits, reduce the risks, we can get the maximum benefit from urban nature. And I think that goes also for nature and biodiversity in general. A part of this work following after the action brief was the start to look into the establishment of a tool, a quantitative tool that we call the Green UR, Green Urban Settings. It's a user-friendly software that helps to measure green space availability and access to green space on local level. And it also helps locally to raise awareness that green spaces are important and it can rely on local data. So the tool is open to bring in the local data set that communities have. So it will help to measure the green space access, to quantify the green space impacts on health, raise awareness, and can also be used for training and capacity development. We're working on the final version of that, and it hopefully will be soon published. And it's using a QGIS environment where all the data can be put in, and then there's all the algorithms to present with the information on how many % of the population have access to green spaces, what are the health impacts, which will be very useful for urban planning to identify where are the less green areas, where are the health impacts that you need to invest in and prevent by urban planning. Following the work on green spaces, we have also started looking into blue spaces. We have been part of a European project consortium called Blue Health that has produced a wide range of blue health tools looking into the health benefits of blue spaces in urban settings and producing guidance for urban planners and designers on how to best use blue spaces in an urban context. There were several modules on the research and on the landscape urban planning side. And one of the work package that was led by WHO was looking into the development of a decision support tool, which you can find under the given link here. The Blue Health Decision Support Tool is, as I said before, for the green spaces, looking into how we can protect from health risks related to blue spaces, be it injury and drowning, waterborne diseases, climate impacts, or vector-borne diseases related to water. But at the same time, it gives information on how you can promote the human health benefits on the mental and the physical health side by social well-being or physical activity, and how you can improve ecosystems benefits, both for ecosystems themselves, but also indirectly for human beings and urban residents. And that tool will give you health information on the risks and benefits, and it will give some information and guidance on what type of features, characteristics, and interventions can be useful to promote the benefits or to reduce the risks. So this is also work we are now involved in, looking into the blue spaces. Coming to the end of the speech, I would like to highlight the impact of COVID-19, because we have now over a year going through different phases of lockdowns and restrictions in accessing public facilities. This is data from Google looking at the community movements and community mobility, where you see that, of course, in spring 2020, a lot of activities, a lot of public mobility went down significantly. We see it for all different sectors of society. And we also, of course, see it for parks, where here in that case, you had almost 2/3 less visits to parks and public open spaces compared to the baseline before the lockdown was implemented. And of course, this does have implications. We talked before about the physical and especially the mental health benefits, and this is exactly where the parks play a role increasingly during the pandemic. And this is why also there have been a lot of voices out there from the science and the civil society to keep the park open, because it is one of the few ways during a pandemic where you might compensate risks, you might compensate especially mental pressures, and the benefits might outweigh the risks of infection. This is something under debate. Different countries and different local authorities have made different choices, but we can see that a lot of cities have tried to keep parks open and accessible for good reasons. So there is some forthcoming work and research studies done on the impact of nature during the pandemic, and one of those finds a positive impact of green spaces during the pandemic based on an international survey published early this year, showing that the lockdown severity and the more severe the lockdown was significantly affected mental health. This is not a surprise. It also showed that nature actually did help people to cope with these impacts, And the effect of nature as a buffer to the mental health impacts was strongest when you had strict lockdown conditions. So what we saw that depending on nature exposure, symptoms of depression and anxiety go up with the severity of lockdowns, and they go down with the degree of having outdoor green and nature spaces available and still able to access them. So maybe a private garden, a balcony, or at least having natural elements in the window view. So even if you could not go there, you at least have a nature view that can compensate. So these were actually buffer effects that help people to cope and develop less stressful symptoms. At the same time, we see and we know from many studies that there are inequalities in access to urban green space and nature. This is just one example from England, monitoring access to natural environments. We see that in the high socioeconomic group, almost nobody is not having any access to private or communal garden, or at least a patio or a balcony to at least get some outdoor exposure. And this goes up almost by factor 3 to the low socioeconomic group, with showing that almost 1 in 5 of the low socioeconomic group doesn't have access to these amenities and nature benefits, which means especially during a pandemic and in the situation of lockdown, these will be the people most affected by the mental health impacts. And this is one increasing inequality that we see coming forward during the COVID pandemic. So to summarize, there's a lot of positive impacts that nature has on well-being and mental health, on the physical health, as well as social dimensions. And if nature were a pill, it would be reimbursed by healthcare insurance. Unfortunately, we're not there yet, but different concepts like the forest healthcare are paving the way in that direction. But we need to assure that nature is available locally and for all, because otherwise we're adding yet another dimension to the health equity discussion. And with this, thank you very much. I hope that was insightful, and looking forward to discussion. Thank you very much.
Thank you, Matthias. One question for you, Matthias.
Yes.
Follow-up question from on your presentation, which is raised in the chat in the Q&A function. This green UR tool, which you announced on QGIS. There's a question by Kamal Acharya, sorry, if this will be available to developing countries like Nepal. So I think Mr. Kamal Arachi, or Mrs. Kamal Arachi, is living in Nepal. Do they have access to this tool once it is released?
The tool is being developed as a joint collaboration between the European Office of WHO in the Environmental Health Branch in Bonn, as well as the global headquarter. And to my knowledge, it has been tested in European as well as other global sites. I mean to recall it has been tested in Accra. I'm not 100% sure, but it is certainly something that would work in different settings. I guess the qualifier is having some local data to put into the tool. Once you have that, the tool would make very little difference regarding the location.
Okay, thanks. It's very, very promising. Okay, thank you also, Matthias, to keep the time. Next speaker is Matilda van den Bosch. Matilda is assistant researcher in Barcelona at the Institute of Global Health, and she is also adjunct professor at University of British Columbia in Canada. She is trained as a medical doctor, and well, I think about 15 years ago, maybe, Matilda, or 20 years ago, you entered this field of the green spaces field. And then starting research on human health benefits from exposure to urban natural environments. You are also the editor of the Oxford textbook of Nature and Public Health. And we're also very glad to have you back in Europe for the great work you are doing. So Matilda, really looking forward to your presentation. The floor is yours.
Thank you very much, Rick, for that kind introduction. And thanks a lot for inviting me here to talk and present some of my work today. So I think I would like to start sharing my screen. So I'll do that. So it doesn't seem to work.
We can see it.
Yes, great.
Perfect, then you can all hear me. Yes, so I was invited to talk about mechanisms and scientific evidence in the field of nature and public health, which I'm very happy to do. Yes, and this is a view of the beautiful city of Barcelona, where I'm correctly situated now, and I'm happy about that, working at the Barcelona Institute of Global Health. So I will talk about the latest studies and scientific evidence that we have. But before I do that, I would like to put this field a little bit into context. And Matthias very nicely put it into the context of the environment and biodiversity loss and so on. So I would like to just quickly mention what sort of diseases we are suffering from today globally. And actually, depression, mental disorders are at the top of the burden, the diseases that people suffer from globally. Then we have the cardiovascular diseases, stroke, chronic respiratory diseases, diabetes, and cancer. These are called the non-communicable diseases. And the common factor for these disorders are that they are chronic, usually chronic. They are difficult to treat in the sort of conventional, traditional medical way, and better to be prevented simply. And I think that there are estimates saying that around 80% of these disorders could be prevented through, for example, lifestyle and environmental related actions. Because why do we suffer from these diseases? So that is very much related to lifestyle, such as stress, high stress levels in today's society, physical inactivity, loneliness, social isolation is a major risk factor for many diseases, urban living, urbanization, and also, of course, climate change. All these are threats that increase our risk of getting diseases, this type of chronic diseases. So what does this have to do with nature? The thing is that nature, natural environments impact these risk factors. And this is actually, as Rick mentioned, I used to work as a physician, but when I started realizing that much more can be done actually outside the hospital by preventing people from coming there in the first place. That's where I started getting interested in this impact of nature on the various risk factors. And Matthias has already very nicely outlined the different pathways, which makes life easier for myself. However, I just quickly want to go through it again. So we know that nature has a positive, it's associated with higher levels of physical activity in societies, social contacts increase if you have access to urban parks, for example. And there's a lot of research on stress reduction. And I would like to say that we stand on the shoulders of giants, those of us who are working in this field today, because there was a lot of pioneer research on this by our colleagues before me. And then we have, as Matthias has also mentioned, the ecosystem services, and we often talk about the regulating ecosystem services, for example, heat reduction, reduction of air pollution, and also later research. I will talk a little bit about this more in detail later, the provision of microbiota through biodiverse soil, for example, because behind all of this is biodiversity, which is, of course, the thing we need to protect in order to get all these benefits from nature. Now let me see, because I sort of get myself here. I made a dotted line there between the urban natural space and different diseases, because this is the sort of research, this is the number of studies or kind of diseases outcomes that we see now coming out from a lot of studies, showing that there is a reduced risk of depression, cardiovascular diseases, stroke, diabetes, asthma, and cancer, exactly the same diseases that I listed before on the slide of what diseases we are suffering from globally. Increased levels of mental well-being, happiness, academic performance, memory capacity, and also sleep quality. We see increasing evidence for all of these outcomes. And this also means that even if the effects of natural spaces, even if we only see small effect sizes in our studies, it has a huge impact on a population level, because these are also common diseases. Yes, just to show you that I'm not simply taking this out of my own mind. This is a long list of the outcomes, the evidence that came out just last year. There I can tell you there are more studies. There's an escalating number scientific studies coming out on this. And I will share the PDF with you if you're interested into looking more into details around this. So these are more the specific outcomes on diseases, but then there is also evidence on the pathways, the sort of mechanisms that lead to the benefits for health. And we know there is significant impact on particularly heat reduction, but also some studies indicate an association to reduction of air pollution. And then, as I mentioned, the biodiversity and the association to the microbiome of our bodies, and then the eventual impact on our immune systems. There is also science studies showing that there is an impact to telomere length, and I will talk a little bit more about that as well later. It has to do with aging and longevity. And then, of course, the climate change mitigation, the carbon sink. All of these are the very latest research, as you see. This came out these studies came out just last year. One question that we often get in this field is what type of nature is beneficial. This has a bearing, of course, on urban planning, decisions, and how to design our cities in the best way to optimize the benefits and improve the planning. This has been difficult to research because we have used quite a lot of the remote sensing images, which sort of gives us an indication of green in general. However, we conducted last year a study, or it was published last year, a study in Vancouver, Metro Vancouver in British Columbia, where we tried to look at different types of urban natural environments. And we used a high resolution land cover map for that. I have it on the next slide. So here is a snapshot, a map of Metro Vancouver, the area. And so we looked at these. We had 13 different categories of urban land cover, separated into, for example, deciduous trees, coniferous trees, and built and paved, and so on. So, and then we looked at general health and mental health, self-reported indicators of this from a large survey. As you see, almost 2 million people in the sample. What we found is that particularly here we had the buildings, paved, coniferous, deciduous, shrubs, grass, herb, and also the total green space and water. And you see a significant impact on the mental health. So you see it's almost 25% reduced risk of reporting poor mental health for shrubs. Shrubs is a little bit of an maybe non-precise, but it's in this map, it meant like small trees, hedges, and sort of smaller green spaces, so to say. Also, there was an impact, a slightly smaller impact, but still significant of an association to exposure to water for general health. So all of these are exposure measurements. We also investigated access to green spaces. So this was particularly access to urban parks. And we see quite a significant effect for men in this study. So indicating that access to public green spaces would have an impact on the reduced risk of poor self-reported general health by almost 50%. However, we didn't see anything for women, and we can only speculate about the reason for this association or the difference in the association. And as I said, we can only speculate, but it could be men maybe have more time after work to spend nice time in the parks while women go back home and take care of kids in the kitchen. All right, enough about such. I mentioned that I was going to talk about the biodiversity pathway because that is one of the later directions the science has taken, and I'm quite fascinated by it myself. So this was a study, this is a research team in Finland at the University of Helsinki that had an intervention study looking at biodiversity. They distributed material with high levels of biodiversity, and they distributed it in sandboxes in daycare centers. And they looked at the biodiversity then of the bacteria on skin and also in the gut. But these figures present the differences between the intervention and the control group with biodiversity on skin. And you can see a significant association, a significant increase in this biodiversity on skin in the intervention group compared to the standard group, and similar. These are just different types of bacteria specificity. So we know there is a relation between diversity on skin and diversity in the environment, but what does this mean for health? Well, the interesting thing was that they looked also at immune markers in blood samples of the same children and saw that this increased biodiversity on skin also had an association to a better immune system function among the children. And this is, of course, very important because this would stimulate different immunoregulatory pathways. And if we build up a healthy gut microbiome in childhood, this tends to pertain throughout life. So we get this life course approach of healthy childhood environmental exposures with benefits across the life. I also mentioned the thing with the telomeres and the aging, and this was a study from Iran where they looked at exposure to green spaces and saw an increase in the telomere length. These are little caps on the DNAs in our cells, and they shorten with time. So when they are gone, we are by the end of our lives. So with exposure to green spaces, they saw better preservation of these telomeres, which would simply explain why the mortality is usually lower. People live longer in green areas. Finally, I just wanted to mention the study I'm conducting, I'm leading in Canada, Born to be Wise, where we're also looking at early life exposures and testing the association to neurodevelopment among children, and where we look at the mechanisms of air pollution and noise reduction by exposure to green spaces. Finally, I also want to mention an Erasmus project I'm involved in together with Rick, for example, the Green for Care project, which I would strongly advise you to visit their website, where there are by now a number of interesting case studies looking at best practice for example, urban green care interventions, where there's a lot of material and information on how we can best achieve urban green space interventions for optimal health. Thanks a lot for your attention, and I welcome questions.
Thank you, Matilda. Always interesting to hear your story. And also thank you for introducing Green for Care. We have Annabelle Sur, who will after lunch spend a bit more time on this very nice and interesting project. So all speakers, very much thank you to you to keep the time. We have a couple of questions in the Q&A box. So just wondering, maybe we can bring up the three speakers on the screen. At the moment I only see Matilda. So maybe Matthias on page 2, can you enable your video so you can answer some questions. Thank you. So the first, I've selected some questions. Sorry, we received too many questions to discuss in the coming 15 minutes probably, but so that's the way we have to work, unfortunately. I have a first question to page 2, and that's a question from Sher de Vries, I think, also an expert in this field. Thank you for attending, Sher. And his question is, to what extent do the social context or group processes may have contributed to the positive effects of forest bathing? So is there an influence of the group of people where you're doing forest bathing with? Do you have an answer to this question?
Sorry, Professor Du is muted.
Professor Du, you're muted. Can you please unmute your microphone? Yes, thank you.
Well, this question
it's a very sharp question, I think. So in other words, essentially you're asking, once we got into the forest, whether it's because of the group activity, group action that actually made a positive contribution to the human health, or whether it was to a large extent to the environment of the forest that made a positive impact on human health. I think we need to do a comparative study. So in other words, we select a group of people in the city, another group of people in the forest, same time, then we carry out the same healthcare procedure in comparison of people in the urban environment and people in the forest healthcare program. So after drawing that comparison, maybe we can arrive at a conclusion that the forest does make a positive impact in terms of reduction stress and also the reduction of the hormones. During my presentation, I didn't really elaborate on the programs we would carry out in urban environment as in comparison with those in the forest environment. So we had that kind of comparison results, but it wasn't carried out by us. It's from a Japanese team. It's a Chinese expert who has been living in Japan for so many years, and he has done certain comparative study. And from his study, you can tell that those positive impact can be attributed to forest environment, in particular, the natural killer cells.
Okay, thank you. Matilda, maybe...
I think that's also the unique positive from Changbaishan Mountain, unique benefit from the Changbaishan forest area, which is quite different to other places. At the same time, as a follow-up program, we will look at different seasons. For example, in where I'm from, we have distinct 4 seasons. In the northeastern part of China, we selected August because we thought that was the best time. We have already designed that we will carry out another program involving 30 different people, and we are about to go into the forest to carry out research. So we want to look at in spring, in March and April, what kind of impact does the forest have on human beings? Because in March and April, we don't have plant essence, we don't have forest essence. So what kind of impact would that be on human body? And then we will be able to compare different seasons and whether what large extent the impact of vegetation has on human body when we don't have plant essence or forest essence. And as a future step, we want to broaden the number of subjects, our samplings, and we want to reach out to community to do more work as well. So different group of people, maybe we want to include people with mental disorders, and we want to include children in our study group as well. I don't know whether I have answered my questions or not.
Yes, yes, definitely. Thank you. Maybe Matilda, do you...
Thank you. 谢谢.
Thank you.
Do you have any comments on this question?
My apologies, Rick. I was reading through the questions that were particularly addressed to me to prepare a bit. So, yes. But I do think that Dr. Dune has given an excellent answer. I think she's the expert in this.
Okay. So I selected the question for you, Matilda.
谢谢.
Thank you, Matilda.
Matilda, there is an interesting question which I also find quite interesting to know. So that's Asha Pedersen is asking if there is a difference, or if the impact is differing between planting single trees or groups of trees when it comes to health aspects. I know it's a very short question, which is opening a very broad discussion probably, but maybe you can give a your short reflection.
Yes, of course. So the difference between single trees and larger amount of trees, I would say in all this, I think we need to remember what type of health outcome we are addressing. So like a single tree could, for example, single tree could have an impact like from views of the window, for example, which could possibly reduce stress, while a larger space or more trees could promote physical activity, for example. So I think all these, I think a single tree could definitely be important, and also for the biodiversity if we think about different types of trees in a city. But for me, the main answer would be that it totally depends on what health outcome we are addressing, that we're interested in.
Okay. Matthias, from your work, do you have something to add to Matilda's reply to this question? What's the different impact of the different types of urban green space?
Okay, I had to unmute myself, sorry. I think that there's, I would go back to the opening slide that I had. Any type of nature in any setting is useful. I think it depends a lot on the urban structure, and we have seen that street trees, now you talk about a line of trees, so it's not just one, but it's not a group of trees standing somewhere in a small park. I think that individual trees can already have an impact. We have seen that there's a lot of mental health dimensions on just being exposed, on just seeing the view. And if you don't have the forest close by, if this is all you have, a street tree or a very little bit of greenery, and even if it's just ornamental, it may for individual situations and for individual people living in that area, it may already have an impact. I don't know whether you can really measure that in a big study, but I think that any type of green will help. In some areas, you can only put small elements. So I think that's something that is difficult to research on with the individual tree. But I would definitely say having one tree is better than having no tree.
Thank you. That's a clear advice. I will not claim it as a WHO advice, but definitely that's a clear takeaway from this session, I think. Another interesting question, which I've seen coming by, was about the mechanism behind the stress reduction and parks. And I don't know, Matilda, if you remember the question. I think that's something that you can answer.
If I remember the question, that was the around anxiety and depression, or
yes, that
stress?
one. Yes, sorry.
Yes. Yeah. Okay. Well, so the association between green spaces and anxiety and depression, I think, like as you already mentioned in the beginning, there is, of course, or through the pollia, there's, of course, a strong link between stress, chronic stress in particular, and increased risk of depression and other mental disorders. So following on the evidence, as I mentioned, from many decades before, I would say that stress reduction is one of the pathways that we have a fair amount of evidence on. So that would be the link, I would say, one of the pathways. However, it's also the association to physical activity that we would need to take into account in that aspect, since also physical activity is a very important factor in addressing mental health and depression. That's one of the best things you can do to prevent depression, to be physically active. So I think if I would have to vote, I would pick these two pathways for that. But also social contacts, of course, play a major role.
Yeah, definitely. Also see.
我想提个问题。I have a question. May I?
Yes, definitely.
Yes, I have a question. Just now, this lady, Matilda, you talked about the urban forest, the impact of urban forests on the telomere. So I'm just wondering, how did you carry out your research? Telomere, is that word correct?
Yes.
Yes. How did you carry out your research?
Thank you for the question. I did. That was not a study conducted by myself. That was conducted by the leader of that research, was Peige, who is also affiliated to the Barcelona Institute of Global Health. However, what they do in these studies is that they you can measure DNA. You take it from the blood samples, usually from the lymphocytes, or no, it's the leukocytes. It's one type of the blood cells, and there from that you extract the DNA, and then you can analyze it with specific techniques. So it's from blood samples. Okay.
Yeah.
那他这个是做了多长的？就是这个
So this research or this experiment was targeting a group of how many people? And in the context of urban forests, how was the care or how was the rehabilitation carried out? So which means, so in other words, how long did they carry out this whole experiment?
Okay,
and
thank you. So
how many people were included in this target group?
Yes, I said, I don't have that on the top of my head. I think it was around 500, but it was not an experimental study. So that was a population study. So they were looking at exposure to green spaces and access to green spaces in their general life. It was children, I think around, I shouldn't say, but 7, 8 years old, living in green versus not green spaces. So it was more an observational study rather than an experiment.
Okay, I have.
明白了，明白了，谢谢，我知道。
Okay, thank you very much. That was very clear. Thank you.
Okay, thank you. I have maybe one more question and then 2 observations from the Q&A box. There is a question by Rudiger Grote from the KIT in Germany, and it's to Professor Peige too, on the on differentiating physical effects and chemical effects from the forest bathing to forest therapy. So the question is, could the physical effects, cooling and more humid air, be distinguished from the chemical effects of being in the forest? I assume you're getting this question translated. Please, Professor Peige, do unmute yourself. We cannot hear you.
Thank you very much. This is a very deep, profound question. Indeed, in our research, this question has always been bothering us. We are trying to address this question. Indeed, the forest rehabilitation is a holistic environment. We cannot cut it off from the forest. So within this forest environment, there are 2 factors, physical and chemical factors. So for example, the humidity, the temperature, PM 2.5 content, etc., etc. All these are physical factors. But however, the chemical factors, in my personal view, I think it might include the vegetation in the forest, for example, the grass, the trees, and the shrubs, for example, the volatiles they have emitted through the pathways that they go into the human body and their impact on human body. These are the chemical reactions. So therefore, in the forest rehabilitation, it is a combination of physical factors and physical factor and the chemical factors. But what confuses us now, how to, so within the forest environment, how to distinguish the impact of these 2 factors on human body. Indeed, this is very difficult. Well, within the forest rehabilitation, I think the impact on human body is indeed a combination of chemical and physical factors. Thank you very much. Yeah, that's all. That's my answer.
Thank you.
Very good question. This is a very good question from a good expert, I believe. Well, including in the forest, there are other factors, for example, the color, the taste, the smell. Yeah, for example, the red color, the green color, and including the sound of running water, the sound of birds. All these factors can be felt through our eyes or our nose, our ears. All these are physical factors, so which means that we're not only talking about the humidity or the temperature. We're in a wonderful natural environment. People are attracted to do something there in the forest. But of course, the essence of a forest or of plants, we are talking about the essence that are good for human health, but some essence are bad for our health. So which means it is not absolutely true that it is healthy going to the forest. Sometimes there are some pests, for example, or pests or parasites, mosquitoes. All these are negative factors that we should avoid in the forest rehabilitation. But all in all, the forest rehabilitation, the advantages certainly outweigh the disadvantages.
Okay.
Yes, this is a very good question.
Thank you, Cici. We have to come to close more or less. So I take one observation, one very important observation before I have a concluding question, which I will direct to Matthias because it's trying to link to implementation of urban green space. So there is an important observation, I think, by an attendee called BB, and not by coincidence BB, because they are biophilia and biophilic design organization. So you're pointing to a very, very important point, of course, by stating that all this information is extremely important, but there's still a huge interdisciplinary gap between, on the one hand, the researchers in urban forestry and forestry researchers in public health on the one hand, and then also and then the other hand, the architects and professionals in the building and urban planning sector. And that is, of course, very true, because without urban planners and without architects and landscape architects, we cannot implement all these important outcomes. And that's one of the points we're working in the Clearinghouse project, the Horizon 2010 project that I'm coordinating in the EFI office in Bonn. So this day today, or this Urban Forestry Days, is the first event in a series of events the coming 3 years, where we really want to link with professionals and also in the urban planning world. And then, Matthias, I have a tricky question for you. Sorry. And it was, who was it? Cornelia Steyer, she is a student in International Forest Ecosystem Management, and who is raising this question. Maybe we would have, is a question which was maybe more for the panel yesterday, but our question or observation is, with all these insights and scientific proof on the health benefits of green and also blue spaces, what is currently standing in the way of embracing this into designing cities? Is it local policies? Is it the financial side? And maybe Matthias, you can conclude the session by a very short answer to this question. Thank you.
I will try. The problem is that it's a very complex question in terms of answering it. I think it is the case that a lot of cities are trying to get greener. I think this is not something that is a new paradigm or a new objective, because it's coming from research that nature is good for you in urban settings. I think that a lot of cities are trying to become more sustainable, more green, and at the same time more resilient since quite a while. I think problems could be, and this is not a full list, but on the one hand, to build up a nice green setting, a park, it simply takes time. You can maybe build a sports hall rather quickly, but to have a park fully developed and flourish with nice trees, it simply takes time. Cost is certainly an issue, and it's not only the cost of the investment, but also maintaining green spaces is a maintenance and a cost issue. And I think in some areas you might have simply also trouble with existing urban structures. It's maybe not everybody happy if you take down buildings and take away roads or supermarkets to put in green spaces. Some part of the community might like it, some might not. So depending on existing structures, you have opportunities or you don't. So I think a lot of opportunities come with the sustainable planning, resilient planning, climate change, flood mitigation, surface water runoff. These open a lot of opportunities to bring in green spaces for the good of the citizens, at the same time for the good of sustainability and resilience. And I would like to make last comment on what you just mentioned on the gap of implementation. What I would like to see more often is natural experiments. We do a lot of research on things where interventions are created, but there's a lot of cities investing in the green spaces, and it would be nice if they partner up with universities that make a follow-up and an evaluation from an academic perspective. What is the impact of what local authorities are doing, and put a research project on that, and to use these natural experiments for research, and this way could also be cross-fertilizing.
Thank you, Matthias, for this very short reply. That's also something we are aiming to do in the Clearinghouse project. Your answer is linking very nicely to the next presentation, which we will have after the break, which is looking into how to manage urban forests to create health benefits. Thank you, all speakers. Thank you, Peige. Thank you, Matilda. Thank you, Matthias, Cici. Thank you for being panelists in this session. Thank you for your presentation, and I hope you enjoyed it yourselves and that we still have you on board for the rest of the day. So to all attendees, if you still have questions, you can raise them in the Q&A box. We will forward them to the panelists, and we have now a little less than 9 minutes for a short coffee break. Sorry to go into the coffee break, but this was a really interesting discussion. Thank you. See you soon.
Thank you very much.
Thank you very much. Goodbye.
Bye.